Hello everyone, and thanks for joining us on Midday News. We begin the midday news in Abuja, where the leader of the proscribed indigenous people of Biafra, Nnamdi Kanu, has abandoned his earlier plans to call 23 witnesses in his defense on his ongoing trial for alleged terrorism offenses. At the day's proceedings, Mr. Kanu said he had gone through the case file and realized that there's no valid charge against him. He argued that since he's convinced that there's no valid charge against him and that he was subject to an unlawful trial, there will be no need for him to open any defense. Justice James Omotosho asked him to file a written address to that effect and serve the prosecution. The judge advised him to consult experts in criminal law on the consequences of the option he has chosen. He thereafter adjourned till the 4th, 5th, and 6th November for the adoption of the final written addresses based on defendant's position that the evidence led so far and the charge has not established any case against him, or for the defendant to enter his defense. Now to this development story, where Nigeria's healthcare system in few days from now may face another major disruption. This is because the Nigerian Association of Resident Doctors has declared an indefinite nationwide strike starting November 1. And the president of the association, Dr. Mohammed Suleiman, confirmed the decision after an emergency meeting of the National Executive Council following the expiration of a 30-day ultimatum given to the federal government. The doctors are protesting poor working conditions, unpaid salary arrears, and government failure to address welfare and training issues. They are also demanding payment of outstanding allowances, reversal of what they call unfair downgrading of newly employed doctors, and restatement of 5 colleagues dismissed from the Federal Teaching Hospital in Lokoja. Resident doctors form the backbone of clinical services in public hospitals, and a strike, if not averted, is expected to severely disrupt medical care across the country. And joining me in the studio is the president of the Association of Resident Doctors, Mohammed Suleiman. Thank you for joining us on Midday News.
Thank you very much. Thank you for having me.
So let's just go straight to it. Yes. So NAD had given the federal government a 30-day ultimatum, which has now expired.
Yes.
And tell us, were there any discussion where the government before now had prevented the strike?
Well, let me even start by making a clarification. We came into office 31 days ago, and the 30 days has expired yesterday. But before that, there was a 2 weeks ultimatum that ended on the day the AGM started. Even before that, there were other ultimatums issued to the federal government on these issues. And the AGM looked at it and said, let us increase another 30 days. And even at the next meeting that happened on Saturday, you can see that action is not starting until the next Saturday. That's an additional 7 days. To further buttress this point, doctors are not really interested in going on a strike. We are starting a strike on a weekend. What are these issues? What are the problems? Have we met with government? Now, on day 26, we met with the Honorable Minister of State. He was very endearing. He was very reassuring. He asked that we shelve this action. And because of his word, we have, as a NEC, decided to add an extra 1 week to see what government will do. What do we expect? We expect reinstatement of our 5 unjustly terminated colleagues in FTH Lokoja. We expect payment of promotion arrears to medical officers as far back as 2021. We expect payment of 25-35% arrears as far back as 2023. Accoutrement allowance as far back as 2024. You know, I can go into some hospitals like FMC Owo, like OAUTHC in Ile-Ife, like Benue State University Hospital, that has arrears ranging from 18 months, you know, to 14 months, to 13 months, to 7 months, and all that. Okay, so I want to ask you this. Of course, the reason for this upcoming strike is basically the persistence of government to meeting long-standing demands. What can you say is the most pressing demand that needs to be addressed, you know, immediately to forestall this strike in the next few days? Well, 2 things. There are remuneration issues. I've mentioned a few of them. Yeah. And I'm sure you understand there is no senator, no House of Reps member, no minister, no permanent secretary, no even director at the federal level that is owed 2, 3, 5 years salary arrears. Others are establishment issues. You know, we have an entry-level crisis. Our doctors, our colleagues, resident doctors are being downgraded, you know, at entry level from Commerce 3 to Commerce 2. We want that urgently addressed. Our house officers, we want their pay to come on time, not 2, 3 weeks after. You know, we're also looking at our professional progression. The government woke up one day and decided, let us no longer call the certificate that these people get after passing exams, let us no longer call it a specialist certification. Let us just call it a certification. Perhaps it may stop them from leaving this country. Unfortunately, that has not. I can tell you the last 10, 12 years, we were 16,000 at the federal level 12 years ago. Today we are less than 9,000. At the state level, we were 7,000. Maybe 12, 13 years ago. Now we're less than 1,500. You know, you can look at it at the private level. We were over 1,000, let's say maybe 10, 8 years ago. Now we're less than 500. You know, so all the measures are wrong. For those of us that are back in Nigeria, you're now saying we can no longer identify a specialist. That same exam I will write, collect that certification, and I'll go to Ghana. Ghana will recognize me as a specialist. You know, so there are establishment matters.
Okay, so
one key thing based on what you asked, there's a collective bargaining agreement where government has allowed for a review of our salaries to take place. Government promised us it will end in a month. Now we are looking at 3 months and it has stalled. If government could push that down the line so that we get over with it, look at the implementables, look at how budgeting can come in, and we move forward. Those are some of the issues.
I think that's also a very good way to hang it, because I wanted to ask you, what can NED do to find a middle ground? You know, so that Nigerians,
for starters,
so that Nigerians will not suffer this. For 30 seconds.
For starters, let them meet us at the negotiating table. Recently, this country talked about tax laws. And to tell you the extent of the rot in the health sector, nobody thought of, okay, these 11,000 resident doctors that are back in the country, what do we do to incentivize their staying? And in all the tax breaks, over 5,000 pages, no one thought about giving tax breaks to doctors.
Thank you so much. Thank you for coming on the Media News. Thank you. In Lagos, at least 15 persons have been rescued after a 2-story building collapsed in the early hours of Monday at number 54 Cole Street, Cemetery Bus Stop, Oyingbo. Emergency respondents, including officials of the Lagos State Fire and Rescue Service, are currently conducting search and rescue operations to free those still trapped under the debris. According to reports, the building had earlier been marked as distressed, and occupants were warned to vacate before it eventually gave way around 12:20 a.m. today. Confirming the incident, the Controller General of the Lagos State Fire and Rescue Service, Margaret Adeseye, said it is an ongoing rescue involving an existing 2-story building which had reportedly been marked as distressed before collapsing on the occupants. So far, 15 people, including 7 adults, males, 4 adult females, and 4 children, have been rescued with varying degree of injuries. She added that the victims have been taken to the Federal Medical Center, Ebute Metta, and the General Hospital, Odon, Lagos Island, for treatment. TVC News, Theophilus Ilama has been monitoring these developments, and he joins me live from the scene of the collapsed building. Theo, what is the current state of the victims hours after they were rescued from the debris?
Well, Ademola, hours after the rescue from the rubble, that figure has gone up. It's now 25 that have been rescued and 1 body recovered. Of course, we have with us the Permanent Secretary of the Lagos State Emergency Management Agency, Mr. Olufemi Oke Osoyintolu, who will be giving us an update on the situation. Thank you very much for joining us at this time.
Good afternoon.
Good afternoon. So, where are we now?
Well, you made a mistake by saying 25 are rescued. 26 were rescued. 21 are in our hospital receiving adequate treatments that were evacuated by our ambulances, while 5 were treated on the ground and discharged. However, we recovered 1 body, and that 1 body has been deposited in the mortuary. I need to appeal to the good people of Lagos State that under the watch of Mr. Governor, Mr. Babajide Olusola Sanwo-Olu, we will do everything that's humanly possible to ensure safety of life and properties. So, when we received the call around 12:11 a.m., we moved in with our local emergency management committee with all the first emergency responders, and we are able to do the needful. You can see that we are systematic in what we are doing. We divided the emergency scene or disaster scene into the 4 quadrants, where the 2 outer quadrants are less vulnerable and is meant for storage, and the other 2 inner quadrants are highly vulnerable. And with that, we are using sophisticated light duty equipment to go down gradually to ground zero. Believe me, good people of Lagos State, we are on top of all our challenges. We have what it takes to ensure
because it felt like a rescue operation wasn't going as planned.
Well, it's because of the strategy we put in. The strategy we put in is that it's based on the information given to us. We are giving different informations that, oh, people are trapped in there. People are trapped in there. They could not give us the roll call. So after gathering the information with them, we have to be strategic in what we are doing, so that we do not use our heavy duty to match in people. We must be technical on what we are doing. So with that, we first of all comb the place with our DESA equipment, with our light duty equipment before we commence activities. And when we commence our activities, you can see how we gained momentum. We can see the number of people we are able to save. You can see that despite the magnitude of the collapsed building, we were just able to recover 1 body. And you can see that the operation is going on, and you can see my team of all emergency responders were on the ground. The directors of all our emergency responders were on the ground. So you will say that we are doing very well under the watch of Mr. Governor, Mr. Babajide Olusola. But you see, our people, they don't have the knowledge about how to manage emergency. They want us to move in to ground zero. They want us to grab. They were anxious. I could sympathize with them. I could understand where they are coming. But I will appeal to them that they should remain cool, calm, and collected. That under the watch of Mr. Governor, we will do everything that is humanly possible to ensure safety of life.
Thank you very much for talking to us.
Thank you.